Reflex incontinence is the subject of this video, so we're going to talk about what that's all about and what is the difference between reflex incontinence and urge incontinence, and what are some of the things you actually need to not be doing about, and what are some of the things you should be considering as a therapy method. So this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine. Stay tuned. All right, so reflex incontinence is very similar to urge incontinence. I've already done a video on urge incontinence, so we're going to make sure that we put it at the end of this video. But reflex incontinence means that the person, it's also similar to overflow incontinence, where you sit down, and a lot of times people don't consider that as incontinence. They think, oh, well, I sneeze or exercise or cough and pee comes out. But with urge incontinence, or I should say overactive incontinence, you're sitting down, you pee, you go to get up, and there's still more pee coming out. So that's what overactive incontinence is. So with reflex incontinence, it's actually more severe, more engaged. It's as a result of the bladder going more into a spasm, so to speak. So when you get up, or when you think you're done, there's even more urine coming out. So then the question is, why is that happening? A lot of times it's infection. Chronic infection really interferes with the performance of the bladder. Sometimes it's as a result of the nerves going to the bladder. They're just not functioning properly due to something else. So then the answer is we look to see what else is going on. Sometimes people are deficient in certain supplements, so you got to keep that in mind always. When it comes to any condition, you got to look at the structure. You need to look at the nerve supply to that structure. You need to look at the emotions. That's always a fair, broad approach to a problem. So with reflex incontinence, one of the things you don't want to do is kegel exercise. Why? Because it's already into spasm, and it actually requires some preliminary work. So the kegel strengthens the muscle, which is important, but when a muscle is into spasm, it's not being strong. It needs to let go of that spasm. So this is the time that actual manual treatment of the pelvic floor muscles is very helpful. So manually, your therapist goes through the vagina or the anus to have access to that region to do some, consider it more of a massage of the pelvic floor muscles, and then biofeedback, where we coordinate the breathing, for example, and coordinate some cueing you to relax the muscle as we're inside and we're working on the muscles inside your pelvic inlet. That's how we get to relax those muscles. Now, once it's relaxed, once things are more under control, then we go and start strengthening them. The biggest mistake that's made is people think to strengthen pelvic floor muscles, they need to do just Kegel. And the answer is no, not necessarily, because pelvic floor is not a free-floating surface. It's attached to your pelvis, your sacroiliac joint, your lumbar influences, your lower back influences, your performance of your lower ab is important. The movement and functionality of both of your hip joints are huge. So these are influencers of the pelvic floor muscles. So it's important to look at the performance of those, not in isolation, like doing a range of motion type exercises, but in movement. So in functional movement assessment, we can see how all these pieces come together and perform together, which is a huge thing that is not happening in most offices that address incontinence and or pelvic floor floor dysfunction. At any rate, if you have any questions, please use one of the methods of contact in the description box. Make sure you subscribe to the channel, and if you want to be added to our email list, all you have to do is just shoot us an email and say please add me, or make a comment in right here for this video. Until next time, take care.